Get ready to pay more if you have health insurance through Obamacare. A new nonpartisan study says premiums for the most popular low-cost medical plans are expected to go up an average of 11% next year. Those are pretty steep increases, especially at a time when, we really don't have much inflation anywhere else in the economy, certainly not when it comes to wages. And, interestingly, these increases are coming just 1 year after the election. Joining me now with more, Republican strategist and Trump surrogate Boris Epshteyn and former chairman of the Council of Economic Advisors, Austan Goolsbee. Good to see both of you guys. Austan, starting with you, what happened to that whole affordable part of the Affordable Health Care Act?
Well, Trish, as I'm sure you know, it's extremely misleading to choose only one type of plan that apply to about 5% of the country.
Austin, it's actually the most popular plan. It's the most popular plan, so that most people have this plan. It's 5%,
most people
but
do
guess
not
what?
have this plan.
5% have that plan.
Trish.
Fewer people have other plans.
5% of the country.
This is a nonpartisan study, I would also emphasize.
You're talking about only people who are buying their insurance through exchanges and only the lowest price plan. That's about 5% of people.
I don't care.
If
5%,
you look at overall health care,
5% of people are not going to see
overall health care costs.
They're going to see their health care costs go up.
In the last 5 years, healthcare cost inflation has been the lowest in a half century.
So now it's going to get worse, and that's a good thing?
Before there ever was an Obama administration, healthcare costs for everyone were rising at double-digit rates and 3 times the rate of inflation. So it's extremely misleading
you're trying to tell
choose one
that
thing
healthcare costs
that
are going
Republicans
down. That's essentially, let's read through the lines. You're trying to tell me healthcare costs are going down compared to everything else?
Slower, not down. They are rising slower than they have risen in 50 years. That's the overall health system. Those numbers come from all the third-party objective observers.
Yeah. Premiums are going up, and that's what's costing the actual individuals and taxpayers more money.
They were
so yeah,
before Obamacare was
somehow
ever
growing
passed.
less, but then you'd have to look at those numbers, Austin. But as far as
those
the actual
numbers
cost,
show that they're going up at a slower rate than they did for 50 years.
Of course, that you're going to try to find a way to spin this positively for Obama. And I understand that. It's just not working at this point in time. What's happening is that the costs are going up because insurance companies simply cannot sustain the burden of Obamacare. You've seen insurance companies lose money in 41
I think it's worth explaining. I mean, it's a little bit of an Econ 101 lesson, and I know you teach that, Austin, so you can help. In other words, if you have all these people out there as a potential pool of applicants into the insurance system, you want to get the young, you want to get the healthy. They need to be there to help offset the costs of the older and the less healthy. But right now, you're in a situation where there's no penalty for not signing up. So guess what? All the insurance companies are left with are the older people, the sicker people. They don't have those there that could offset the cost. And consequently, the cost goes up. Premiums go up for everyone. Why, Austin? Didn't the president put in a bigger penalty so that at least he could have guaranteed his system might have had a better shot at working?
I will answer. Do you want an answer? It is extremely cheeky for Republicans to specifically try to sabotage the exchanges in Obamacare by changing the rules that were precisely designed to address this issue of what they call the risk corridors. Republicans blew that up, and now they are complaining about the impact of blowing it up. If you light the burners on fire, you do not turn around and say, hey, this meat is overcooked. That's exactly what the Republicans have done.
So let's look at the bottom line here. The bottom line is that this is what Obama ran on. Now Hillary's running on it. It is an utter failure. The exchanges are failing all over the country. Premiums are going to go up not by just 10, but 20, 30, 40% in some states. And the burden, who will be on? The middle class.
And let's face it, you know what? We haven't even talked about the burden employers feel as a result of this. And the stagnation it's really going to bring to the economy because nobody's adding that 50th employee because you're going to get hit with this. Boris, Austin, thank you. We're going to be right back.
Thanks so much.